since we opened, we've seen about 7,000 total patients, total visits. About 3,400 of those have been new patients to us.
To the Ohio State Medical.
To the James Diagnostic Clinic. And of those, we have about 40% that end up with some kind of cancer diagnosis.
This is the James Cancer Free World podcast. I'm Steve Ortenberg, and today's topic is the rapidly growing James Cancer Diagnostic Center, and we have 4 of the center's key people with us. In the first half of the podcast, we'll be joined by Dr. Raquel Reinbold, a cancer oncologist, associate chief medical officer of the James, and the medical director of the Diagnostic Center, and also Tina Sowers, the administrator of the James Diagnostic Center. After the break, we'll be joined in the second half by Rupa Ghosh Berkebile and Victoria Krogh, who are nurse practitioners and 2 of the Diagnostic Center's advanced practice providers, and they'll provide and explain to us their all-important role in the Diagnostic Center and the patient experience. Welcome, Raquel and Tina.
Thank you so much for having us.
Boy, I've heard a lot about the Diagnostic Center, and it seems to be going great and growing, so give us a little of the background and the history.
Sure. Do you want me to start, Tina?
Yes, please.
All right. So in 2019 or so, James leadership had kind of conceived of this idea of, how do we reach more patients who have some type of worry for cancer? And really, how do we have a new front door to the James for patients who might not otherwise have a primary care or some other entry, if you will. And so, that was happening. And then, of course, COVID happened. And I would say that probably even accelerated this idea even more because remember, I don't know about you, but not many of us left our house.
Right.
Certainly avoided going to healthcare. And, we wanted to meet people where they were and try to help.
Yeah, because we heard people got behind on their mammograms and colonoscopies and and prostate exams.
Sure.
So people were behind. So you had to catch up.
Yep, absolutely. And so ultimately, we opened our doors in June of 2020. And we've been, I guess we haven't looked back since, right?
Yep, been busy ever since.
So Tina, from the administrative side, which is interesting, we usually have the doctors who talk about the medical side, but this has to be, the logistics and planning has got to be kind of a lot of moving parts going on at the same time.
There were a large number of people who took part, tried to get the clinic off the ground and up and running, and so we're really grateful. It was everyone from just our scheduling teams to our nurses and to the nurse manager of the clinic, right? And so this whole group of people came together to get things started. And we were lucky we had some project planners, some people who really dive into the detail to make sure that when we did open, everything opened well and with a good start.
Yeah, because I've got to imagine there's 100 or more people involved in the planning and creating this thing. And what you mentioned before about COVID, so you started the planning before COVID, and it was almost like in the midst of a bad situation, it was a good coincidence because it was needed even more.
Absolutely. And, you have to think about it. Most of us often access healthcare with referrals from a primary care doc or what have you. But what about if you don't have one of those?
Yes, which a lot of people don't.
Yeah. So, we were able to take self-referrals. We're trying to accommodate patients in their home and did telemed visits and try to be a little bit more creative about how we provided this resource to patients.
Wow, you mentioned telemed visits, and that's another thing that came out of COVID.
It's a silver lining, one of these silver linings.
So yeah, you need to take advantage of bad situations to create better situations.
Absolutely.
Wow, so just give us the logistics. The Diagnostic Center opens in which building and what kind of space is it? Well, Tina, why don't you fill us in on that?
Yeah, so we opened in June of 2020, and we opened in the main James Hospital.
On campus.
There's on the 5th floor of the main campus, there are outpatient clinics, and so we utilize that space and some of the staff to get started in that clinic.
What does the space kind of actually encompass?
It's I guess I call it our typical clinic space, so that our providers, the nurse practitioners, work with the nursing team in a large room, but then we have clinic rooms that they go and see the patients in. And then they have our checkout staff, and there's a certain clinic flow to all our James clinics, and this one follows very, very similarly to all our clinics.
Okay, and Raquel, fill us in on sort of as the medical director, your role in building the team of doctors and nurses and practitioners that are going to be there and helping patients?
Sure. So, we have I think a really, really incredible model. So the clinic is largely run by two of our fantastic advanced practice providers who have doctoral training. They are just awesome care providers. They're supported by really amazing nursing staff as well. And the thing that's really, really cool about this is, they really personalize the care. They meet patients where they're at. It's obviously a time of high anxiety. Anyone who's worried about some sign or symptom for cancer, they want a plan yesterday of how we're going to handle this. And I think this team does a great job of trying to, get that plan in place as soon as possible. And of course, they're also backed up by wonderful administrative staff. There's a host of people behind the scenes who help this kind of come to fruition. My part is much smaller in that I just try to help out with tough questions sometimes. But as I said, the clinical team is really great.
So, Tina, fill us in a little bit on kind of the growth and like how you started in terms of the referrals and numbers of people you were getting and where that is now and maybe even future growth. And then Raquel, you can chime in after.
We started off, I'll say, a little slow in the terms of getting used to the concept and really going after it. But then we were fortunate, our James team and especially our marketing team, if you flew in and out of Port Columbus in the last few years, right, there was a lot of diagnostic clinic advertising. We've had advertising on TV. I think that's a little bit of that word of mouth and grassroots piece of it, the marketing of it to say this is unique and you can have good access, quick access to care. And so we've really emphasized that, and that helped us grow.
That's a good point. I mean, that people need to know about it before they can come here. And even primary care physicians who might not have heard of it needed to learn so they could start referring people. And so it's and plus you opened in the middle of COVID when people were not coming out because it was before the vaccine. So it sounds like I can imagine that it was a slow growth and then it just really took off.
We anticipated a certain amount of growth, right? So when you do a clinic like this, so I'm putting on the administrative hat, you anticipate a certain amount of growth and a certain amount of number of patients that you will see. And really, when our first couple of years, it exceeded that beyond what we anticipated. And so we grew very quickly, very fast. And then now we're back at a little more of a normal pace that we would have anticipated.
So Raquel, I'm really curious from a medical standpoint, were there certain symptoms or problems people are having that were driving them to you?
Yeah, so we see all kinds of different things in this clinic. Certainly folks who have kind of unexplained lumps and bumps. We see plenty of patients who maybe went to the emergency department for a particular symptom. They ended up having some kind of imaging done, and it showed kind of an incidental or unexpected finding. And so our team will ingest that and kind of help work through it. We have plenty of referrals from primary care docs. I think a lot of what this clinic does is also outstanding care coordination. And the piece of that, too, is that we work really, really closely with our James specialists, which I can't underscore the importance of that enough. Being able to take sometimes very challenging clinical presentations and say, oh, gosh, what do we do next? And having a really multidisciplinary, comprehensive discussion with some of our experts, that's been very helpful, too, to kind of navigate some of those symptoms.
Yeah, I'm always impressed by the expertise of the experts that come on the podcast in every kind of cancer that there is, and you get the people that come into the right people immediately. And I know this might be a tough question, but is there any way you can estimate for us or have numbers about how many people you've seen and what percentage or numbers of those actually have a cancer or cancer-related kind of illness?
Tina, I'll let you take this one.
We have probably, since we opened, we've seen about 7,000 total patients, total visits. About 3,400 of those have been new patients to us.
To the Ohio State Medical.
To the James Diagnostic Clinic. And of those, we have about 40% that end up with some kind of cancer diagnosis.
Wow. And Raquel, is there, this might be hard to answer, but can you categorize the types of cancers you're seeing most commonly And does it fit in with the types that are most common?
Sure, sure. So we, see plenty of cancers, blood cancers, if you will, or things like I mentioned earlier, things with lumps and bumps and lymph nodes that are enlarged. We also see a fair number of kind of GI cancers as well as lung or thoracic cancers. But quite frankly, one never knows what's going to walk through our clinic. And sometimes too, it's not cancer. While that's certainly a relief, we do our best to at least maybe we don't come up with the diagnosis, but at least to send that patient to kind of maybe the next best place, if that's a different type of expert or having a discussion back with their primary care doc.
Yeah, and that's being part of the Ohio State Wexner Medical Center, you
Absolutely.
have those experts available.
Absolutely.
So we've talked a lot about early diagnosis and why that's important. So I take it that that's sort of the mission of your diagnostic center, to diagnose people early, but just again, fill us in on why that's so important.
You want me to start with this one?
You can start.
All
yes.
right.
This is Raquel.
Yeah, sure. Well, certainly we see better outcomes. Patients have better quality of life, less treatment toxicities, and we know how important it is, especially in solid tumor cancers, when we have an opportunity to do surgery and remove it and cure patients, that's where we really want to catch folks. So there's so many reasons for that, and that's why we're firm advocates of screening and trying to be aggressive about, not ignoring symptoms and trying to figure things out early when able.
Yeah, and it seems like this is a great way to fulfill that James mission of reaching out to underserved communities. Like you said, people who don't have primary care physicians. You can reach people who might otherwise not have been scared or had the resources to see a doctor.
Sure, absolutely. We want to be that connection and at least, as we said, get patients started in the right direction.
Fill us in a little, this is kind of my final question for you before we take a break, but it's been since June of 2020. What has it meant to each of you to be part of this new and really great diagnostic center? And Tina, why don't you go first? Sorry to put you on the spot there.
No, I think that mission of the earlier we diagnose this, the better the outcome the patient has. And I think that is certainly the most important thing we do. And then, and this is just one of those things that as we have talked with other organizations, we've had the opportunity to share how we've done this and share with our colleagues across the country. It has been very interesting to me, the interest level in this type of early diagnosis of cancer clinic. Stanford, Duke, UC, San Francisco, some of these really big other places that you think of, and they want to know how we're doing it. So that's been very exciting to be able to share how we're doing it to take care of patients the best way possible, and they want to learn from us. Oh,
that's a great point. I hadn't thought of that. You're at the cutting edge of creating a standalone, not a standalone, but an incorporated diagnostic center. Absolutely. Okay, Raquel.
This is a hard one. I've learned a lot since, I've been lucky enough to be in this space. For me, when I think about cancer, there's a lot of just uncertainty. There's a lot of, it's a loss of control for patients. And I think one thing that this clinic does is try to formulate that plan, kind of give some of that control back, and doing so in an incredibly compassionate and, like I said, personalized way. I think that's a gift, and I think that's just been really incredible to be a part of and see firsthand, what our providers do for these patients and their families.
Okay, well, that was a great overview. So thank you, Raquel and Tina, and we're going to take a quick break and be right back with Rupa and Victoria.
The best outcomes for treating cancer come from early detection and early diagnosis.
The James Cancer Diagnostic Center at Ohio State
is designed to provide rapid evaluation and a clear diagnosis.
We are transforming care by giving patients direct access
to cancer experts who study and treat cancer every day.
If you think you have cancer, the choice is clear.
Choose the James Cancer Diagnostic Center.
We're back with Rupa and Victoria, and advanced practice provider is a term I'm not familiar with and very curious about. So fill us in on what that is and some of your training and background. And Rupa, let's start with you.
Okay.
But don't tell everything, so we'll give Victoria a little chance to tell us about what you guys do.
So An advanced practice provider is kind of an umbrella term to refer to nurse practitioners and physician assistants. We typically have master's degrees. Many are now doctorally prepared. Many are oncology certified or have some sort of other specialty certification in addition to our adult nurse practitioner, family nurse practitioner, acute care nurse practitioner certification.
Victoria, Rupa said something about being doctorally prepared. Is that sort of the equivalent of like a medical PhD?
Oh, it's different, but Rupa and I both have doctorates in clinical practice, so it's called a Doctor of Nursing practice. So we have kind of the terminal degree in our nursing field.
Wow, so you are about as highly trained as nurses can be and are really experts.
We try.
We try to be, yeah.
So why is that important in this setting to have that training? So Rupa, why don't you start with that one?
I think it's important to have as much training as you can have. In this environment, we are, as you know, the James, in general, our providers, including our nurse practitioners and physician assistants, are pretty highly specialized for the most part. Our clinics are pretty highly specialized. We're a little different in that we have to sort of have a general knowledge.
Oh, that's a great point. Yeah.
Yeah, and so it's helpful to be up to date on the latest evidence and the guidelines and things like that from multiple cancers, because we don't really know what's going to roll through the door. But not just for that, some internal medicine as well, because we do see people who have cancer, but then they have other comorbidities or other diseases that kind of play in to their cancer diagnosis, or their cancer diagnosis was, it comes along with, okay, you have pancreatic cancer, and oh yeah, by the way, you now have type 2 diabetes as well. So they're dealing with not one issue, but two, and we sort of have to have a general knowledge of a lot of different things.
Wow, so you're specialized in many kinds of cancer.
Kind of a jack of all trades, so to speak.
So Victoria, sort of walk us through what it's like for you and for patients when someone comes in, like kind of draw us a diagram of the process.
You mean when a patient's first coming into clinic for the first time for evaluation?
Yeah, okay. What's that like, and what's your role in the whole process?
Yeah. Well, first, let me start kind of with before the patient comes. We get a referral. Either the patient calls and refers themselves into our clinic because they're concerned about a symptom or problem, or another provider refers them to the clinic, or they come from our emergency department. There's a couple different entry points. We get that referral, triage, make sure they're in the right place. We see them in clinic, and that's when the workup starts. The nurses will room them, get some of the preliminary information that we need to kind of help get us started as far as symptoms and overall concern. And then the advanced practice provider, namely Rupa or myself, as nurse practitioners, will go into the room to see the patient and start the workup, depending on their reason for coming in.
Wow, so Rupa, I've got to imagine that the anxiety stress level of people when they come in can be kind of high. And over your years of experience, how do you sort of help patients relax and not be scared?
I think from a personal level, I personally try to find something to break the ice a little bit. Perhaps it's something I saw in their history that they are interested in. Maybe it's something where we share common ground. Maybe we both have college-age students and kind of what you're dealing with there, or that type of thing. It can vary. I try to find a small thing to break the ice, and I'm a human, and so are you, and it's going to be okay no matter how this turns out. And we just try to handle it with calm, honesty, in a compassionate way.
But it sounds like you've thought about this and plan and have strategies to do it. It's not spur of the moment. And
we usually have a plan before we walk in the door to see the patient for the first time, and a lot of it comes from that initial referral that Victoria mentioned, and the records that we get ahead of time and review, and we pour over the chart. We review just about everything there is in the system so that A, we've done our homework, and B, we have at least a tentative plan, and C, the patient feels like we care about them and we've gotten to know them, and they don't have to regurgitate that information 10,000 times.
Wow, so Victoria, You've also, in addition to kind of empathy and learning how to connect with people in pretty quickly, you need to be able to explain complex things to them in simple English, and not just them, but I'm sure the person who's there with them. So how do you do that? How do you practice and get good at that?
I actually have a system that I use when I see patients. We have dry erase boards, and I love teaching. I like getting on the dry erase board and kind of writing out, hey, these are the things that showed up on your imaging that we need to look into, and here's the things that we're going to do today to look into those concerns. And I think that helps them, especially people who are not used to all the medical terminology.
Yes, which is almost everyone you see.
So many big words that we're using. Lymphadenopathy. Well, what does that mean? What do you mean lymphadenopathy was on my scan? So breaking it down, putting it on the dry erase board, because not only are they hearing it from us, but they're seeing it written down so they can kind of, it cements a little further in their minds by the end of the appointment.
Wow, I already knew this. My wife is also was a pediatric oncology nurse, and nurses are kind of natural caregivers, expert at that. And I can see that you both are just really good at that. And since you're both modest, Rupa, why don't you tell me a little about Victoria and her nursing, caregiving, practitioner abilities? And then you'll get a chance to talk about it.
Yeah. In a good way. I think Victoria wears her heart out on a sleeve. She's very compassionate and caring for her patients, and will go the extra mile to make sure a question is answered, or their needs are met, or they feel that personal touch or follow-up connection. And like she said, she likes to draw. I don't like to draw. I explain things in a different way, and I go back and recap a lot. So we each do things differently, but I think we complement our styles well.
Wow, I bet Victoria, you're a visual learner, and you're not, and so you're a visual teacher.
Yeah, teacher. Yeah.
Okay, so Victoria, now your turn to tell us how great Rupa is.
Yeah, Rupa's great. Rupa is excellent. Rupa has so much experience nursing, and especially as a nurse practitioner. And then also, she puts a lot of hard work into her patient cases. The notes are extremely detailed. Her plan is detailed. The workup is detailed. So she's very thorough, and her patients love her.
Since this is new at the James and kind of a groundbreaking kind of nursing, what have you each learned in your time in the diagnostic center? And we'll switch it up. And Victoria, you can go first this time.
Okay. Well, I have been part of this clinic since March of 2022. So it's been 3 years. I have learned so much. My background was mainly, surgical, and then I did hematology, lymphoma specifically as a nurse practitioner. And then I come to this clinic where it's not just lymphoma, it's so many different types of cancers. So I have learned so much professionally, medically, and I've also grown as a person and as a provider into this role so that I can best support my patients.
Wow, thank you. And Rupa, how about you?
Well, I like Victoria. I've been doing this for a while, and I've been in a lot of different places. I came more from a solid tumor background. This is why I say our skill sets complement each other so well. I also have some surgical background as a nurse, but as a nurse practitioner, mine's all medical, and it's all solid tumor. So I have learned a lot, just skill set wise, about blood cancers. I'm still asking questions every day, but I've also learned a lot more in more depth about solid tumor. But what I love is that I spent 9 years of my career on the inpatient, what is now the cancer medicine service, but it used to be the medical oncology service. We built it from 2 services to, I think, 8 now. So what I love about this clinic is I've gone back a little bit to my roots. I'm able to use my inpatient medical oncology and hematology brain in an outpatient setting. And so it's been nice to be able to do that again. And also, I think there's a lot to be said about learning how to break bad news. I did it in a different way on the inpatient service, but being there at the beginning, I think is really important, and the patients will always remember how that is delivered. The day you hear those 3 words, "you have cancer," is life-changing. And knowing that it's life-changing, that's kind of an awe-inspiring moment for me, because it's like, okay, you got to get it right. We don't always get it right, but deliver it with as much compassion and honesty and hope as possible, because sometimes people hear that word and the hope goes out the door, and I'm like, no. There is hope here. We will get you to the right people. They will come up with a plan for you, and then you can make an informed decision and put the control back in their hands as much as possible when they feel like their world is spinning out of control after they've heard those 3 words.
Wow, the honesty, hope, and compassion, the way you deliver news, I think if you do that's you can't go wrong, and that sounds like you both do that. And it also sounds like nursing is a very rewarding profession, and that this will be a great recruitment tool for people who want to go into nursing, and that I'm guessing that there's so many levels and different things you can do that are rewarding. And Victoria, your career is kind of a testament to that.
Absolutely, yeah. This job in particular, I mean, all of my jobs have been rewarding, but currently this job is rewarding because you help patients in a very vulnerable time of their lives. And what's great about our clinic is that we can get people in so quickly to see us in clinic. And so, they were scrambling for answers, and they were trying to get in to be seen by someone, and we were able to see them quickly, and that matters to people. And then we get the workup started.
Yeah, I hadn't even thought of that, but at least you have an answer to what's wrong with you. And even if it's those 3 words, and not the answer you want to hear, at least you know something.
Right. Yep. That's what I tell people too, because the uncertainty, like when we're waiting to get them to biopsy, or when the biopsy's been done and we're waiting for the pathology results, that's very uncertain, unsettling time for our patients. So we do the best we can to stay in touch and let them know that we are right on top of it and we are following. And as soon as we know, they will know, because that's important. They need to know that we are watching.
Well, I think the patients at the Diagnostic Center are lucky that you two are watching them. And thank you for what you do and for filling us in and letting people know about what goes on at the James Diagnostic Center.
Thank you.
Thank you.
This podcast is brought to you by the Ohio State University Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute. For more information, check out our website, cancer.osu.edu.